When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Our next guest is suing the Quebec government for violating rights during the COVID-19 crisis. Jean-Félix Racicot is a lawyer in Mont Saint Hilaire. He's behind this lawsuit. Hi, Jean-Félix. How are you?
Fine, thank you.
So, why, in a nutshell for our listeners, why are you suing the Quebec government?
Okay. First of all, I have to do a little bit of history for your listeners. What I'm asking for is a relief for habeas corpus. The notion of habeas corpus comes from English law and dates back to the 13th century, the Magna Carta. You have to understand that before that, you had the kings that were all powerful, so they could render justice, they could imprison people, they could vote laws, they could do everything. So the king was almighty.
Okay, so but what is the Quebec government doing here that makes you think of kings and queens that are just deciding what they can do? Because, you know, let me go about it. Give me a few minutes, okay? You don't have all the time in the world, right? So be aware of that. So, yeah, go ahead.
You know, if you want to make a simple argument about something that dates back to Magna Carta, that won't happen. But give me a few minutes, okay? So, Englishmen decided that if the king was to stay the king for everybody, he would have to relinquish a part of his rights toward them. So one of them was the right to imprison them, to limit their liberties. And to guarantee that the English people would have the right to have protection from the king actions or the government action, then they created the writ of habeas corpus. And that's the protection that every citizen has against the state when their rights and liberties are taken away by the government.
Okay, so
they can present themselves before a court and ask for relief from the superior court.
Understood. But let's talk about those rights those rights and freedoms here that you feel are under attack unjustly, because as I see it, you know, sure, I can't go to a rock and roll concert right now. That we can't have a gathering in a park. Yeah, we can't do that. But we're trying to prevent mass death, right?
Okay,
There's a reason for that.
So that's the basis of the reasoning. If we go back to the beginning, you understand that the reason why there was a confinement, they told you so many times, it was to flatten the curve, okay? It's not to stop people from dying. It's not to stop people from being sick, because we know even a law cannot do that. What we were trying to do is to make sure that the healthcare system would not be overwhelmed and would be able to respond to the needs of the people as it was ongoing. Okay? That was the goal of all these measures.
Of course, but that's the same thing, right? If you try and make sure that your healthcare system is not overburdened, what you're trying to do is avoid what we saw in various other countries. Once the system gets overburdened, it leads to extra death for no reason. So it is the same thing.
That's based on projections that we know now were wrong. Okay.
What was wrong? I mean, people followed the orders, and our health experts actually said this. By the way, if this works, it may look like an overreaction. They even told us this.
That's not true. Okay, just give me a second to answer.
Wait, let me listen. I'm doing the interview here, sir. So I have to ask you this: are you saying that your right to go to a restaurant is higher than the right for my parents in their 70s and 80s to live? I mean, people have a right to live, don't they, sir?
Yes, but are you telling me that because I would be working, I would be attacking the right to live of your parents? What correlations do you do with both of them?
Of course, we all know that the government hasn't stopped people from working. A lot of people are working from home.
It hasn't? Okay.
No, the government hasn't stopped people from working. In fact, people can work from home. There are industries that are affected. We all know that the restaurant industry is getting hurt very hard, for instance. But there's a reasoning and rationale behind that.
Are you someone that's you, and you don't want to give me time to explain to you?
You've got time
behind it.
You've got plenty of time. Keep going.
Okay, well, there's no justification and reason to do that because look at what's happening in Sweden. Okay, they are not going about the way that we're doing, and the healthcare system is not overwhelmed because the basis of the estimates that they did in March was that there was no asymptomatic cases, okay? And those estimates they don't want to provide us. You know that everybody has been asking the government to provide, and they don't want to provide.
They did provide them, right?
They did not. They provide new estimates on the 7th and on the 13th. And even those estimates are way above the reality, okay? And they're more optimistic because they're still using the Italian model that we know is not happening and won't be happening. And do you know why it was so bad in Italy? Is somebody asking the question why it was so bad in Italy? Have you looked at it, why it was so bad in Italy?
Are you going to say the population's older, or are you going to go to the actual answer that Italy has a history of not listening to authority, and they didn't listen to directives at the beginning?
Okay. And have you looked at the fact that in the region, because it's not all of Italy who's going sick, it's the Lombardy region near Milan. So do you know what's happening in the region of Milan?
Tell me.
Well,
you seem to have all this stuff. You mentioned Sweden.
No, everything's there. You just have to look. So people don't want to look; they want to be told what to say. Yeah. So a free person in a free country, you must use his head and try to find by himself.
Jean-Félix,
don't listen to government. The real reason
let's use your head for a bit, Jean-Félix.
Okay, there's 50,000.
Are you going to a CHSLD? Okay. Are you going to a CHSLD, Jean-Félix? Have you gone to volunteer in the hospital? Are you doing it because you feel in freedom so much? Are you doing it?
Sorry?
Are you going into the healthcare system and volunteering? Have you volunteered at a hospital? Have you volunteered at a CHSLD because you're not worried about this?
No, I'm worried a lot about what's happening in CHSLD, okay? That you're not getting my point because those are the people that should have been protected. Because we know since the beginning that the people that were dangerously affected by this disease were the oldest people and the person also that were sick and that pre-existing conditions. And when we know that in CHSLD, there's 26% of the populations there who are going to die in the next 6 months. That's government statistics from last year. Okay?
So are you looking at the protests in the U.S., people like going out to the state legislatures and saying that the similar laws put in place by U.S. states, that those are unreasonable? Are you looking at those protesters and saying they're onto something, they're doing the right thing?
Well, I cannot speak for what... frankly, for the last few days, I'm working for a case. I have to be in court tomorrow morning in Saint-Hyacinthe to make the presentation of the case. So, frankly, I haven't been
so what's
what's
reasonable?
On TV much, no.
Jean-Félix, what's reasonable to you? Can the government do anything to stop a pandemic? What's reasonable? What could they have done that's reasonable in your mind?
They should have done what's been done in Sweden.
Okay, so, man, I don't understand the whole Sweden thing, man.
If you want a right answer, the best thing would have been to do what had been done in South Korea, to use science. So make a lot of testing, treat the people who are tested and put them aside. Once they're okay, you can put them back in society. South
Korea, the government has been much more heavy-handed. Right the way, they've done the testing, but they've been much more heavy-handed because they can get away with it because the population trusts the government there. Head over to. It's so funny you keep mentioning Sweden. So head over to my Twitter if you have the time because I posted the current chart. It's as of April 22nd, and it's great info on Sweden, Denmark, Norway, and Finland. And you know what? Sweden is not looking good on April 22nd. My thanks to you, Jean-Félix, for joining us.
It's getting better. Do you know why?
Jean-Félix Racicot is a lawyer in Mont Saint Hilaire, and he's going up against the government for their laws in the COVID-19 crisis. My thanks to Jean-Félix. I think he made it very clear. He went to a whole bunch of, he went to the greatest hits of certain people that you find on the internet. It's fantastic.